UCSF Medical Center Mission Bay is one of the most technologically advanced hospitals in the nation and sets historic milestones in San Francisco. It is the first hospital in the city with a helipad. It has more robotic tugs than any other hospital in the world. We are ready for the greatest challenges in science, medicine, and patient care. The six-story UCSF Medical Center Mission Bay is 3 hospitals and a medical office building connected by the main floor. Elevators are generally divided into those designated for the public, staff, or materials transport. Here are some highlights of the Gateway Medical Building. The first floor is where you'll find radiation oncology. Floor 2 contains clinical labs, pathology, and the blood bank. The women's clinics are on the 3rd floor. You'll also find an infusion center, adult and pediatric blood draw, and adult prepare, which clears patients for surgery. The adult cancer clinics are on the 4th floor. Floor 5 houses the pediatrics surgical specialty clinics. Peds dialysis is also on this floor. And the 6th floor contains the pediatric medical specialties, as well as the Peds Prepare and Peds Treatment Center.
Yeah, I think the views for our patients, they will really enjoy because they'll see all of the Bay. They'll see downtown San Francisco. They'll see the huge Mission Bay complex.
I think my favorite are all the outdoor spaces. I love the fact that our patients and their families are going to be able to be outdoors, even in this beautiful building where the rooms are bigger and the decorations are so much nicer. It still feels good to be able to get outside and take a deep breath.
In the Betty Irene Moore Women's Hospital and Baker Cancer Hospital, you will find the Medical Center cafeteria and dining room on the 1st floor. The 1st floor also houses the Conference Center, consisting of a large auditorium and 4 other conference rooms.
Conference rooms currently are always an issue because we never seem to have enough of them. And so we really put an emphasis on making sure that on every floor we had adequate room for conferences. And we've put in sophisticated equipment in order to teleconference to other hospitals or other sites within the UCSF system.
The 2nd floor is the perioperative floor with adult pre-op PACU, operating suites, and the fetal treatment center.
The integrated OR delivery system is to be on the very most cutting edge. The idea is for the operating room to be a learning and teaching environment. All of the technology is designed to minimize any harm that can come to patients.
The 3rd floor of both this hospital and the Children's Hospital is dedicated to the birth center and the intensive care nursery.
In the ICN, I think we really focused on the interaction that we wanted to maintain between the parents and the child. So every ICU has a family zone in which the parents can actually stay in the ICN with their child.
There are windows in between each one of those rooms so that they have line of sight, not only to another baby they're caring for, but maybe to a colleague that needs their help and can signal to them to come over.
Floor 4 is the adult ICU, and adult acute care surgical units comprise floors 5 and 6.
I think that's the beauty of this project and of this hospital, is that it engages people to be in the room with patients more so than ever before, because I think that's what patients need and deserve, and that's what our staff want. They want to be close to the patient at all times and be able to be there to be able to give care.
In the Benioff Children's Hospital, Level 1 houses the Children's Emergency Department, Ronald McDonald House, Adult and Children's Radiology, and the main security office. The 2nd floor has children's pre-op PACU and operating rooms, as well as interventional and procedural suites for adult and children, including a hybrid OR and IMRI.
In our 3 hospitals on this campus, we will be providing both routine care, but also very cutting edge and novel care to patients who perhaps couldn't get that type of care anywhere else in the world.
As mentioned, the third floor extends the birth center and ICN. Level 4 contains the Children's ICU, Cardiac Transitional Care Unit, Cardiac ICU, and the main pharmacy. You'll find the Children's Med-Surg Unit and Med-Surg Transitional Care Unit on Level 5. The 6th floor has Children's Hem-Onc Unit, Children's Blood and Marrow Transplant Unit, and Child Life Spaces.
I think my favorite features of this facility is the fact that it feels like a home. Everything you see here, you'd see at a very fine hotel. When you walk in, you feel very comfortable, very relaxed. It's an atmosphere that invites family, children, and their loved ones to be very comfortable as they're having care done here at Mission Bay. Because the space allows for the patients to have their family members in the room, and given the family lounges that we've installed and rooms for them to actually cook meals or to do their laundries, they can be here on site.
You'll find evacuation signs on every floor at the entrance of the stairwell. In case of an emergency, these signs will show you the safest routes to exit the building. In every corridor, fire extinguisher cabinets are located every 75 feet. You can easily spot them under the red signs. When a fire alarm is activated, you will hear a loud noise and see flash strobes. To activate a fire alarm, pull the white T-handle forward on any of the pull stations located at entrances and exits, stairwells, and elevators. Fire doors will automatically close when the fire alarm is activated. Please do not prop open or block fire doors. An area of refuge is a designated place for those unable to evacuate the facility. The button triggers a phone call to the fire control room, allowing emergency personnel to communicate with you.
We took a lot of time in designing the structure to make sure it withholds within an earthquake. A lot of redundancy has been built into the building for electrical, water, all those types of things that you would need to have so the hospital could still function in a natural disaster.
Among the high-tech features of the hospital are the robotic tugs. 7 departments will have tugs to facilitate delivery of medications, supplies, and removal of dirty items.
So for the staff, we really won't want them to spend 3/4 of the time transporting these things between the departments, but really take that time and focus on the patient.
The OneView interactive patient console will be used for displaying care team member names and photos, assigning patient education videos, telemedicine, meal ordering, and more.
You can charge the food to your ATM. It actually will allow them to look at their medical record, if that's appropriate, when the physician comes to speak with them. And then actually at some units allow them to do Skype calls so they can have video calls between themselves and their family members while they're here.
This building for many of us is an opportunity to practice differently. You know, we've talked a lot about technology, but I also really hope that every staff, every clinician, every person on the healthcare team sees this as an opportunity for all of us to bring our best possible selves to Mission Bay.
We hope that for the world, this facility could be a model for how hospitals and healthcare delivery structures should be built, should be managed, should be thought about. It certainly could mean for the world the way in which translational medicine can be facilitated by close proximity and careful planning.
It's another part of the legacy of UCSF. I think for the world, it's a place where people can come to visit to see innovation, happen right in front of them and say, wow, this can really happen.